UroPatient. Tune in and see. Power your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Today we'll explore an exciting new direction in bladder cancer treatment. The combination of Enfortumab Vedotin, or EV, brand name Padcev, with Pembrolizumab, or Keytruda. We'll go over these medications, what they are, how they work, and what patients can expect. So let's start with a quick overview. Urothelial carcinoma is the most common bladder cancer. It starts with the urothelium, that thin layer of cells that line the inside of the bladder, ureter, and part of the kidneys. Now these cells, make sense, these cells come into contact with urine, which can carry harmful substances that sometimes damage the DNA in the cells and cause cancer. So everybody thinks about lung cancer causing, smoking causing lung cancer. Well, those bad carcinogens are filtered through your kidneys, converted to get rid of in the urine, and hits those linings. So it begins in the lining of the urinary tract and can sometimes spread to nearby structures like the ureters and kidneys. Now, traditional bladder cancer treatment has typically focused on surgery, chemotherapy, and radiation therapy. In early stages of the disease, doctors can often just perform a transurethral resection, or what we call TURBT, to remove tumors from the bladder lining, and kind of show a picture of what that looks like here. Sometimes followed by a treatment called intravesical therapy, with medicines like BCG, which are placed directly in the bladder to prevent recurrence. And a lot of times these have been very successful. For more advanced diseases, even a radical cystectomy or complete removal of the bladder may be necessary, often combined with systemic chemotherapy, that means in the veins, before and after surgery to kill any remaining cancer cells. While effective for many, these treatments can cause significant side effects and may not fully control metastatic disease, leading to the development of newer, more targeted immuno-based therapies, which is what we're going to talk about today. So let's introduce our focus. The combination of EV and Pembrolizumab. EV is a targeted treatment that delivers a cancer-killing agent directly to tumor cells, while Pembrolizumab, or Keytruda, helps your immune system recognize and fight cancer. Combination. EV works like a guided missile by delivering a cancer-fighting drug directly to the bladder cancer cells while minimizing harm to healthy cells. It's called an antibody-drug conjugate, meaning it combines a special antibody that recognizes and attaches to a protein called Nectin-4, commonly found on urothelial bladder cancer cells. With a chemotherapy-like medicine, once it locks onto the cancer cell, Enfortumab Vedotin enters the cell and releases its drug payload, which destroys the cancer from the inside. This targeted approach makes the treatment more precise and can reduce some of the side effects seen with traditional chemotherapy. It finds cells that have a marker called Nectin-4 and releases that drug to destroy them, limiting damage, by the way, to those other healthy tissues. Now, Pembrolizumab, or Keytruda, helps your own immune system recognize and attack cancer cells. Normally, cancer cells can hide from the immune system by using a shield called the PD-L1, which tells immune cells, "Don't attack me." But Keytruda blocks this signal by targeting the PD-1 receptor on the immune cells, essentially stripping away that shield and allowing your body's defenses to see and destroy that cancer. Instead of killing cancer directly like chemotherapy, Pembrolizumab empowers your immune system to do the work, your own body fighting it, offering a more natural and lasting way to fight the disease. Now, here's the big kicker. Together, these two treatments pack a 1-2 punch. EV directly attacks the cancer cell, while Pembrolizumab supercharges your immune response. This chart illustrates how combining those two drugs, EV and Keytruda, significantly improves outcomes for patients with advanced urothelial carcinoma compared to traditional treatments. Now, while standard therapy offers modest benefits, and pembrolizumab alone improves both survival and tumor response, that combination of EV and pembrolizumab delivers the highest results, showing a marked response in overall survival and tumor shrinkage rates. This highlights how the two treatments work together. Recent studies demonstrate that patients treated with this combination live significantly longer compared to those receiving standard chemotherapy. Many also experience tumor shrinkage, leading to its approval as a first-line treatment for advanced bladder cancer. As with any treatment, side effects unfortunately can occur. The most common side effect of Enfortumab Vedotin and pembrolizumab include fatigue, skin rash or irritation, numbness or tingling in the hands and feet, we call that peripheral neuropathy, dry eyes, diarrhea, and loss of appetite. Now, these occur because EV delivers a potent drug directly to the cancer cells, which can sometimes affect some healthy tissues, while pembrolizumab attacks the immune system, which may also attack normal cells. Most side effects are manageable with proper care, dose adjustments, and close monitoring by your healthcare team, so it's important to report any new or worsening symptoms promptly. You can manage many of the side effects with good old self-care and communication. Simple steps like hydration, drink more, skin care makes a big difference. Always tell your care team about any new symptoms you may be experiencing early on. So EV and pembrolizumab is intended for adults with advanced or metastatic urothelial carcinoma. So that means not that early, quick one that they can go in there and remove with a quick surgery. Advanced metastatic, meaning it's spreading, particularly when the cancer cannot be removed surgically or has spread to other parts of the body. Before starting treatment, doctors evaluate a patient's overall health, organ function, and previous therapies to ensure it's safe and appropriate. Not everyone's a candidate, so your oncologist will review your history, lab results, and imaging studies to determine if the combination therapy is good for you. Now, both of these medications are given through an IV infusion. EV typically once a week for 3 weeks, pembrolizumab every few weeks, and your oncologist will monitor your progress with imaging and lab tests. Monitoring is essential to ensure the treatment is working and safe. Regular scans check tumor size, and lab work ensures your organs are tolerating the treatment. Cancer treatment affects the whole person, body, mind, and spirit. Eat well. Stay active. When possible, reach out for emotional support. Managing stress is just as important as managing your symptoms. Always come prepared with questions. Ask if you're a candidate, what side effects to expect, and what financial or emotional support options are available. EV plus pembrolizumab marks a breakthrough in bladder cancer care. It's offering hope where options were once limited, and research continues to bring even better treatments on the horizon. These are exciting times, folks. I mean, these are patients that unfortunately didn't live past 5 years when they had that diagnosis, and many of them are living out much longer. So, tune in every week to learn more.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see. Baby, your health for you and me. Knowledge is power. We make it clear. Every Saturday morning, the podcast is here.